Malaysia TIMA provides free clinics, health checkups, and also practice medical care in the communities. When the patients cannot reach the hospitals, TIMA volunteers go to their houses to provide the medical care as well as psychological support.
According to 2019 Annual Global Retirement Index, Malaysia places first in the best medical care category in the world. Despite that, there are still many underprivileged people in the country who need medical care in the forgotten corners.
Many care recipients have mobility issues or they lack transport. Therefore, they cannot go out to receive complete or continuous treatment.
In 2001, Malaysia TIMA has formally been established with the purpose of curing the illness, treating the patient, and healing the mind.
With the concept of hospitals without walls, we practice medicine in the communities. For instance, if a patient has been discharged from the hospital, but he still needs medical care, we will execute our community medical care. This way, our medical professionals can go help him at his house. Not only do we treat patients' wounds, we also help patients who have suffered a stroke or had a car accident. We've also discovered that many terminally ill cancer patients need psychological counseling. Therefore, we provide psychological care too.
The patient's feet were injured when she was pricked by plants with thorns 8 years ago. Her feet were infected and would not heal.
When we first contacted her, we were here because of her financial situation. Seeing the wound on her feet, we thought about TIMA's care.
Her blood circulation is poor and her 2 feet have fire cross veins, so the infected wound cannot be cured. We assess how much medicine she needs and make adjustments. The team who cares for her will go to the designated pharmacy to get the medications for her. Oftentimes, the hospitals are very busy, so the doctors and nurses cannot provide them with the important psychological support, mental support, and financial assistance. TIMA and Tzu-Chi volunteers come to provide mental support, so her illness will heal soon.
For 6 years, TIMA doctors and Tzu-Chi volunteers have provided care to her and helped treat her feet wound. Not only has her health condition improved, she has also become more optimistic and now even volunteers at the recycling station. The community medical care is made possible by the joint work of humane doctors and nurses. They've also provided a much-needed support to the sick and poor in the society.